Despite her 21 years as a medical examiner, Dr. Jan Garavalia still finds certain autopsies especially difficult.
Nobody likes to do babies, but unfortunately we do get them in the morgue. Poor thing. Baby, gosh, how old is he? 15 months old. This is a true tragedy, a true accident. I can't imagine, as a parent myself, how hard that must be to lose a child. It would devastate me.
But these cases are not just devastating. They're also some of Dr. G's most complex medical mysteries.
They're difficult cases in that there's subtle changes that could cause death. We're looking for sometimes very minor evidence of trauma. Belly's a little distended. Very minor changes indicating an infection.
Each year, the District 9 morgue sees approximately 45 infants who die without warning or apparent cause. Sadly, Dr. G's next case is one of those unfortunate few. It's 2 a.m. on a quiet Monday morning, and 21-year-old Sarah Price wakes to the hungry cries of her 4-month-old twins. Half asleep, the young mother nurses them both, first Charlie and then his sister Robin. After about a half an hour, she returns them both to their crib and heads back to bed.
Then she woke up at about 7 to check on the twins.
But as Sarah approaches Charlie's crib, she realizes something is terribly wrong.
She heard the twin girl crying and noticed that the little boy was not moving.
Right away, she turns Charlie over on his back, but it's clear that he's not breathing. Terrified, she calls 911. Paramedics arrive on the scene in minutes. But it's too late.
They try to resuscitate it, and they couldn't.
Now it's up to Dr. G to find out exactly what caused a seemingly healthy baby to die so suddenly.
So today we have a baby. It's just died this morning, at least found this morning. 4-month-old little boy, has a twin sister.
According to the investigators' report, Charlie and his sister were born 9 weeks premature.
They weighed just about 4 pounds, each one of them, when they were born. They were hospitalized for an extended period of time.
But looking at the medical records, baby Charlie's health problems appear to have been a thing of the past.
He's been gaining weight, he's been doing well, he hasn't had any real problems.
However, Dr. G knows all too well that premature babies like Charlie often fall victim to infections.
Premature infants are more at risk for infection because their immune systems are immature. Their bodies cannot react to those infections.
Every year we have several that die from pneumonia, and every year we have 1 or 2 that die from a meningitis.
And Dr. G must also consider another likely culprit, a previously overlooked birth defect.
You know, it's always a possibility that this child has an undetected congenital abnormality.
A congenital defect is any abnormality in the structure of the body. The most common abnormalities we see usually have to do with actually the heart. The other organs are probably the solid organs of the abdomen, so the kidneys and the liver. It's actually very important to find whether or not a child has congenital anomalies as early as possible, because often those defects can be repaired.
But an even more disturbing possibility is that baby Charlie was the victim of accidental trauma, or worse, abuse.
I always suspect foul play or trauma because there's at least 1 to 10% of these actually turn out to be homicides. There's a lot that this could be. Ultimately, I may not find an answer.
And if If Dr. G's unable to determine exactly how Charlie died, his death may end up being ruled as SIDS, or sudden infant death syndrome.
These are infants under 1 year of age that after a complete investigation, x-rays, all the ancillary tests, toxicology, review of the medical records, after all of that, there is no cause of death. Nobody knows the reason for SIDS. It's probably multifactorial.
The reality is that we don't know, but it's probably related to brain and cardiovascular system maturity.
But Dr. G hopes that she won't have to rule this a SIDS death.
There's really no joy in that. We have this nice term, sudden infant death syndrome, and it makes everybody feel good because, like, we know, we don't know. We don't know. It's unexplained.
At this stage, only one thing is certain. Time is of the essence. If baby Charlie died from an infection or congenital defect, there's a strong possibility that his twin sister Robin could also be at risk.
And the mother's also concerned that whatever killed the little boy is going to kill the little girl. And so she is really on pins and needles waiting for the results of that autopsy.
We've all done the smell check.
Trust me, I'm good.
Claire V targets vaginal odor at the source. Claire V, long-term relief from vaginal odor, itching, and discharge. Try it at clairv.com.
At Consumer Cellular, we pride ourselves on getting you the exact same nationwide coverage as the leading carriers for up to half the cost. But don't worry, we've got a lot more than that going for us. Woo! Like this beautiful store in Arizona, for example. It's the perfect place for me to tell you a little bit more about our phones and how they can become your phones. You name it, we probably got it. We have the top smartphones from all the major companies. If it's state-of-the-art cameras you want with space-age metal housing, we got them. If you want a smartphone with lots of bells and whistles but won't break the bank, we've got that too. We even have flip phones like the Iris Flip. If you're someone that doesn't need all that mumbo-jumbo and just wants something simple. And now, we even have watches.
We do.
No matter what device you choose, you'll be happy to know that if your data needs change,
No problem.
with our Smart Flex feature, you don't have to sweat it. Like say you're on a road trip out west and end up using a bunch of data. We can simply flex you up to the next data tier for as little as $5. Then, when you get home, you can flex right back down with no penalty. So you only pay for what you actually need.
With Consumer Cellular, you get the exact same nationwide coverage as the leading carriers for up to half the cost.
I know what you're thinking. What if I don't have one of these amazing stores in my town yet? Can I get these phones sent to me?
Yes, you can.
Will our award-winning customer service help me switch over or add a line for $15 to make my own family plan?
Of course they will.
Is it easy?
Easy as pie.
You see that tower out there? It's a beauty. And there are thousands more like it, working hard for me and you, supplying 5G coverage to this beautiful nation of ours. We know how important coverage is. That's why we offer a risk-free guarantee. If you're not satisfied within 30 days of activation, you can pay nothing. Oh, look.
And for a limited time, new customers get their second month free. Call 800-311-5340. Find us in Target or visit consumercellular.com to switch today.
She knows what she's talking about. Pick up the phone.
When you get approved with Drive Time, you get the real deal. It's the Drive Time Real Deal Maker.
It lets you customize the real down payment and monthly payment of the car you want to buy.
That's super smart. And the deal you make on your phone is the deal you pay. You make the deal yourself.
Get the real deal at drivetime.com.
Homeowners, when your water or sewer line breaks, it's expensive and often not covered by basic homeowners insurance.
You could pay thousands.
Finding a good contractor can be tough.
Want this guy doing the job?
With a plan from HomeServe, call us. We'll send a contractor, and there's no big bill.
Easy.
But don't wait. Get a plan from HomeServe before a line breaks.
Go online now.
Plans from HomeServe start at just $7.99 a month.
Call 1-833-743-6209 or visit homeserve.com.
Looking for a way to stretch the dollar? With Insurify, you can cut your car insurance bill in half. Scroll through dozens of prices and tap to switch online. That's it. No phone calls and no wasted time. Go to Insurify and save today.
Trying on glasses using Warby Parker's virtual try-on is so lifelike, so realistic, that you might not even be able to tell what's real from what's virtual. Yep, it's that good. Virtually try on hundreds of styles in the Warby Parker app.
In Dr. G's morgue, on a cold stainless steel gurney, the tiny body of 4-month-old Charlie Price paints a heartbreaking picture of a life cruelly cut short. And this autopsy will be particularly difficult for her tech on the case, Brian Mahalski.
How I feel about autopsying babies is I don't particularly like it. The stress tends to be a little bit higher on babies, and it also depends on the circumstances in which the baby passed.
But neither Brian nor Dr. G can afford to let the added stress get in the way of their work.
Oh boy, this is a really sad situation. But my concern is to get the right answer.
Dr. G's first step is to scan the infant's entire body, keeping her eyes peeled for any visible clues.
I know he was born 31 weeks, which is premature, but he's looking good now. He's gained weight. Do you see his hair? How pretty it is? He looks well cared for. Okay, chest is 50. I want to do very accurate measurements on its length, on its crown rump, basically the top of its head to its buttocks. Crown rump is 44. I want to measure the head circumference, the chest circumference, the abdominal circumference. This will help me tell how it's grown since its birth. When I look at the baby's legs, he's got needle marks. I think it's a needle puncture mark. But he's got needle marks where we'd expect them. So it looks like that's from resuscitation. You know, babies are very hard to get intravenous catheters in. They're hard to get to give them fluid and medicine. So what they do is they put a needle in, what we call an interosseous needle, a needle right into the bone, and then give the medication or fluids that way. So he's got some on the shins, and that's where we'd expect to see him.
Next, she checks for signs of possible abuse, starting with Charlie's face and head.
I look very carefully in his oral cavity because when I'm looking for signs of suffocation, I'm looking for maybe the mouth being pressed down, smothering. After a very thorough examination, I see no evidence of trauma. Of course, I look at the neck very carefully. I look in the eye, look for broken blood vessel. Usually means they're somehow trapped or wedged between the bed and the wall, and that certainly can be a cause of death. Eyes okay, but he doesn't have any of that.
Still, despite the absence of obvious trauma, a fatal head injury remains a prime suspect.
Just because I don't see trauma doesn't mean there's not trauma on the inside.
But before she looks inside, there's one more step in the external exam. X-rays.
We're looking for subtle fractures to the spine, to the ribs, to the extremities.
And it isn't long before Dr. G spots something suspicious.
What I'm seeing is some possibility of some rib fractures on the left side, and that's worrisome. You know, it just kind of heightens my worry that this might be an abusive case.
If her suspicions are correct, Charlie's twin sister Robin could be in immediate danger.
This is important because, you know, if it truly is, we need to get the twin out of there as fast as we can. Yeah, of course. So I'm ready to go with him.
Baby Charlie may be the youngest decedent in the morgue, but his autopsy will unfold much like any other, with some subtle differences.
My instruments are pretty much the same. I'll use smaller scissors and a smaller scale because the little organs are so small, they don't register on our adult scale. So I have to use a little baby scale that measures in grams. I have trouble even positioning the baby because what we call the head block that we usually put under the back is just too big for a baby. So I usually just roll a towel and put on the baby's back to kind of help it put its head back. So some subtle differences. Alrighty.
Dr. G starts with her standard Y incision. She then peels back the skin to get a closer look at Charlie's fractured ribs.
His left ribs, 3, 4, 5, and 6 are fractured. There is no hemorrhage associated with those fractures. Means that those fractures are done when that heart wasn't beating. So that clearly indicates that those fractures occurred with cardiopulmonary resuscitation. We okay?
Next, she surveys the organs in situ, looking for trauma, infection, or any congenital abnormalities.
Let me look at the spleen. I make sure that all the organs are in the right place, because sometimes babies, there are some syndromes where they're not. Okay, that looks good. Nothing screams out at us.
Then she takes samples of baby Charlie's blood for toxicology and removes his organs one by one for dissection.
When I do dissect the heart, I look at the valves, I look at all the vessels, I look at the heart musculature, make sure there's no holes that shouldn't be there. The heart looks completely normal to me.
The lungs, liver, and kidneys all appear normal as well.
Unfortunately, even though I don't really find anything, I can't rule out a congenital abnormality or infection until I look underneath the microscope. Oh, absolutely.
Dr. G wraps up the internal exam, still puzzled as to what could have caused baby Charlie's sudden death.
So, I'm still not quite sure why he died, but I still would like to look at his head. In this age group, the most common way for them to suffer abusive injury is to the head. Yeah, go for it.
Another condition she'll be looking for is bacterial meningitis, an inflammation of the membranes covering the brain and spinal cord.
Infant meningitis can come on very quickly in this age group. These children can go from looking good and looking healthy to death within a day.
And if Charlie did in fact die of meningitis, this could spell disaster for his sister, Robin.
There is a chance that if the baby died from meningitis, that other twin is in danger too. Oh gosh, okay. Oftentimes, there are things writing on an autopsy. The best I can do is stay objective and cool and try to do the best job I can.
Hey, you folks. Matt McCoy here to talk about the AARP auto insurance program from the Hartford and why people love it so much. This is a good movie. Looks like it got a 94% thumbs up. Now that's pretty high. Even that's less than the 96% of customers 50 and over who recommend the Hartford. In fact, 4 out of 5 AARP members who switched to the Hartford from companies like Allstate, State Farm, and Geico got a lower rate. And many of them saved hundreds on their auto insurance. Not an AARP member? Hey, not to worry. The Hartford can help you join in minutes.
To start saving on your insurance today, get your free quote by calling the Hartford at 1-800-684-6093 or visit trusthartford.com.
I hear this place is great. 90% of diners recommend it. That doesn't beat the 96% of customers who recommend the Hartford. You just can't beat benefits like disappearing deductible. Plus, they offer new car replacement.
New car replacement?
Yep, if your new car is totaled, the Hartford will pay the full replacement cost.
The camera on this phone is amazing.
It's only a 93% satisfaction rating, though. Still less than the Hartford. You know what else? You could save even more if you bundle home and auto. For the savings, benefits, and best-in-class claims experience you deserve, make the switch today.
Join the millions of drivers 50 and over who switch to the AARP auto insurance program from the Hartford and get the savings you want and the award-winning claims experience you deserve. To get your free no-obligation quote and see how much you could save, call the Hartford at 1-800-684-6093 or visit trusthartford.com. The Buck's got your back.
If you have ugly yellow toe fungus, let me tell you about the secret 2-minute trick that I found for my husband. Thousands of people are using it to get rid of their toe fungus. It's called Crystal Flush. It works from the inside and the outside. I mean, he tried everything. Nothing helped. His toes were nasty. Crystal Flush is the only thing that's worked. In just a few weeks, his toes looked amazing. You guys need to try this. I'm telling you, this stuff is different. And you can try it risk-free. You have nothing to lose. Go check it out now. Go to crystalflush.com.
Coming up next on True Crime Network.
Dr. G is about to perform the cranial exam on 4-month-old Charlie Price.
Let's see what's going on here.
She's hoping it will reveal what killed him, because in this case, another life might hang in the balance.
Okay.
That of his twin sister, Robin.
You might even say that that second twin's life is at stake. If I find trauma or some inherited problem that that child has had, if it's there, I gotta find it.
As a first step, Dr. G cuts across baby Charlie's head and peels back his scalp.
When I reflect that scalp, I'm looking for evidence of contusions.
But after great scrutiny, she finds no indications of bruising. Then, morgue technician Brian Mahalski carefully slices through the skull using an oscillating saw.
The cranial exam is going to be the same on the baby and the adult. The cranium is a bit different. Certainly the bones are thinner, more pliable. It's got a soft spot, meaning that the bones haven't totally fused together. Now, if it's a neonate, a very young baby, we could actually cut those sutures with our scissors and just kind of open up the skull. Although at this age, at 4 months, we'll use the saw. Okay, let's see. And as I immediately remove that skull cap, I take a look at that brain. Let's see. There's no blood anywhere. There's no evidence of brain swelling. There's no clear evidence of trauma.
Dr. G immediately informs investigators that she's found no evidence of abuse. This finding clears Charlie's mother of any wrongdoing.
There's always a huge sigh of relief when I tell the detective that there's no signs of trauma, because they do not like investigating baby homicides.
But the cranial exam is far from over. Next, Dr. G carefully examines the baby's meninges, the membranes that protect Charlie's brain and spinal cord, for any signs of bacterial meningitis.
I look to see if the meninges are clear. I look to see if the cerebrospinal fluid looks clear, and they do. If it was meningitis, it looks very cloudy. So nothing that I could pinpoint to his head that would have killed him.
As the autopsy comes to an end, Dr. G still has no clue as to how baby Charlie died. Now she realizes that the only hope of finding out what killed him may very well lie outside the morgue.
I need a scene recreation. I need my investigator to go out to the scene. Hey, Carol, I need to see how the baby was put to sleep, how the baby was found. Could the baby have gotten trapped in a crib? Could the baby have gotten wedged along the side of an adult mattress? How is the baby sleeping?
Dr. G dispatches investigator Carol Crosby to Charlie's home, the scene of his death.
What my job is for Dr. G, I'm the eyes and ears when I go out. I go and obtain the information. When I got there, the mother was very, very distraught. She just didn't know what she did wrong. I explained that I would need to take a reenactment doll in to place a child in the position that the child had been found. I took pictures of the bedding beforehand, then I placed the baby down, and I took pictures from different angles.
When Carol returns to the morgue, Dr. G carefully examines the new evidence. And to her surprise, she spots an important clue.
Okay, thanks. Well, with that scene recreation, that case is starting to make sense. It doesn't mean we have the answer. I still have to rule everything else out. Okay. We still need to look under the microscope, and we need to look at the cultures for the bacteria. We need to get the toxicology. No answers can be complete until all those pieces are together.
Four weeks later, the reports arrive at the District 9 morgue.
The results come trickling in. and there was no evidence of infection in his blood. I look under the microscope at all his tissues. There was no abnormalities, no other congenital defects. I'm not finding anything.
And these negative results lead Dr. G to one undeniable conclusion.
Now that we've ruled everything else out, we know what happened.
It's 2 a.m., and after nursing her hungry twins, Sarah Price places both infants back in their crib. Little does she know that in doing so, she may be endangering their lives.
What my investigator finds out is that there's tremendous unsafe sleep practices with these children.
The reenactment photos confirm that Charlie was placed face down on his stomach, a known risk factor for sudden death in infants. But that's not all they show.
Not only does the mother put the babies to sleep on their tummies, she puts them to sleep on their tummies on a soft pillow. The baby probably liked having that pillow over his face.
And what the mother thinks is a cozy and comfortable position for the baby is actually a deadly one.
If you put the baby on a soft pillow, the baby's going to sleep completely face down and not move their head about 34-35% of the time if they're on a soft surface. That causes a rebreathing of their own carbon dioxide and not getting enough oxygen.
This should have triggered Charlie to wake up and turn his head. But instead, the 4-month-old falls into a deep sleep, and with every breath, his oxygen intake decreases.
His respiratory rates go down, his heart rate goes down, to the point where he ends up dying from lack of oxygen.
It's a tragic ending that raises a major question.
Why couldn't the baby just move its head? He should have been capable of that.
It's a mystery that may never be solved. But experts do believe that some infants suffer from an unknown congenital defect in which low levels of oxygen simply don't rouse them from sleep.
There's probably some predisposed problem with the child. Maybe it just has some mild abnormalities either in the brainstem or the heart. Will I ever know what his weakness was, what his vulnerability was? No, I won't.
But she does know that Charlie's inherent vulnerability, combined with his unsafe sleep position, ultimately led to his death.
So you have to have almost a perfect storm where these overlap. And that's why every kid doesn't have a problem. In fact, most of them won't. How do we know which kid is vulnerable? How do we know? We don't. And we just have to assume all kids are vulnerable, and we don't put them in these unsafe sleep practices.
Finally, Dr. G can close the case on Charlie Price. She rules his cause of death as SUID, sudden unexpected infant death. In this classification, there's a known external factor that contributes to the death. In Charlie's case, his sleep position. Now the only thing left is the difficult task of reporting her findings to Charlie's mother, Sarah.
She's shocked. She said, this is the way her mother taught her to put the babies to sleep. And you know what? We've progressed since then. Unfortunately, not everybody puts the kids on their back. Even in the United States, at least 13 to 15, 20% still put the babies on their tummies because the babies like it that way. They sleep better. Well, that's just the problem. They maybe sleep too good.
As sad as this story is, Dr. G takes comfort in the knowledge that her work may have helped save an innocent life.
Although we can't do anything for this baby and it's a tragedy, at least we can do something for the twin. We know that the unsafe sleep practice probably played a role in this death, but that's something we can correct for this baby and possibly save it from the same fate.
It's all too often that Dr. G sees families devastated by the loss of a child. But similarly tragic are the countless cases in which a young parent dies, leaving their children behind.
The typical healthy 23-year-old guy collapsed suddenly in front of the 4-year-old. It's got to be traumatic for the kids.
They get it. They know how it works. And more importantly, it works for them.
I don't have any anxiety about money anymore.
I don't have to worry about a mortgage payment every month.
It allowed me to live in my home and not have to pay payments.
If you're 62 or older and own your home, you can access your equity to improve your lifestyle. A reverse mortgage loan eliminates your monthly mortgage payments and puts tax-free cash in your pocket. Call 800-282-0712.
It was the best thing I've ever done. And
Really?
yes, without a doubt.
Just like these folks, AAG can show you how a reverse mortgage loan uses your built-up home equity to give you tax-free cash.
It's a good thing.
Why don't you get the facts like these folks did?
Call right now to receive your free no-obligation info kit. Call 800-282-0712. 800-282-0712.
Stay tuned to save $10 on the amazing socket fan light from Bell & Howell.
When you're hot, nothing feels better than the gentle cooling breeze of a ceiling fan, right? The problem is you're going to spend hundreds of dollars on the fan and just as much to have it installed. Not anymore. This is the revolutionary socket fan by Bell & Howell. The amazing 2-in-1 ceiling fan and light literally takes 10 seconds to install. Let me show you. If you can screw in a light bulb, you can hang the socket fan light. Is that easy or is that easy? Socket fan comes with this handy remote. You've got 3 light settings and 3 fan settings with a push of a button. You can control the light and the breeze that you need. Socket fan fits any standard light socket. And if you have deep recessed lights, just use the socket extender. Closets and bathrooms can be stuffy and smelly, but socket fan constantly circulates and refreshes the air all around you. If you want a ceiling fan and light installed, well, then you need a professional contractor. Or you can do it yourself and install socket fan in less than 10 seconds. So easy. Socket fan delivers portable, powerful, cool, refreshing air and bright light wherever and whenever you need it.
And now, the socket fan lights with a deep socket extender is yours for $59.95. Act now, and we'll take $10 off. So you get it for just $49.95 with free shipping. Order now, and you can get a second fan for 50% off. And the shipping is free. And when you order, learn how to get the contractor's discount on the family-sized socket fan set.
Get cool fast with socket fan. Here's how to order.
Call 1-800-647-8024. That number again is 1-800-647-8024. Go to buysocketfan.com. So call 1-800-647-8024. That's 1-800-647-8024. Or order online at buysocketfan.com.
A Talkspace therapist will be in your corner for whatever comes up and be a place for you to vent day or night when you need to. Talkspace is covered by most insurance plans and may be no cost to you. Go to Talkspace.com to get started.
If I was back at the beginning, I would choose SNHU all over again.
If you're on the fence about getting your degree at SNHU, you can do it.
At SNHU, having the support that I had really helped me understand what I can accomplish.
After I graduated, I started a new job. My degree has opened new doors that I truly didn't know existed.
All it takes is one simple step, and it can change your life.
Start your future today at snhu.edu.
Trying on glasses using Warby Parker's virtual try-on is so lifelike, so realistic, that you might not even be able to tell what's real from what's virtual. Yep, it's that good. Virtually try on hundreds of styles in the Warby Parker app.
At the busy District 9 morgue in Orlando, Florida, approximately 35 new cases come through the doors each week.
So we've got that. Should we take this off now?
Most of these are routine.
Yeah, this guy's not looking good. It was clear why he died.
But Dr. G always welcomes a challenging case.
Okay, wait, I'm not doing anything, so let me figure this out. That's the part of forensics I love.
Look at that.
When you can go a little bit deeper for the answer, and particularly when it means something for somebody.
It's 3 p.m. on an unseasonably chilly October afternoon in Kissimmee, Florida. And 23-year-old Roman Glebinski is busy spending some quality time with his kids.
I got some bananas.
Victor, aged 4, and Maruska, aged 2.
The mom went out shopping and left him with the 2 kids.
But when Anita returns home, she's stunned to find her husband collapsed on the living room floor, unresponsive.
She calls EMS, and they come and take him to the hospital. They tried to shock him, but they could not get him back, and he died in the emergency room. I think it's got to be fairly traumatic for the kids to have seen their dad collapse, but the wife's devastated also.
Dr. G begins by reviewing the investigator's report.
Well, we have a 23-year-old male with no prior medical history and doesn't go to the doctor, takes no medications. I mean, there's really not much to sink your teeth on here, except that it appears he died suddenly.
But Dr. G does take note of one seemingly minor detail in the medical history.
His wife said that as a child, they had told him that he'd had a heart murmur. A heart murmur is basically when the doctor listens to your heart with a stethoscope and he hears more of a swish sound instead of the beat, beat, beat sound. And basically all that tells him is that the blood is not going the way it usually does.
It's considered a dangerous symptom for an adult, but for a child, it's a fairly standard finding.
Heart murmurs are quite common in children. About 70 to 75% of all children at some point get told that they have a heart murmur, and the vast majority of them have what we call innocent murmurs, where the physician is just hearing the sound of blood as it flows through the heart.
Most of the ones in pediatrics, it really doesn't indicate anything.
The heart murmur on first glance would seem an unlikely suspect.
Do you want me to do clean shots of hands?
You know, in your 20s is not a common age for sudden death.
But Roman does indulge in a risky habit shared by over 26.2 million men in the United States: smoking.
He does smoke 1 pack of cigarette a day.
But Dr. G doesn't think this habit caused Roman's death.
I don't expect to see changes that are severe enough to cause death at the age of 23 because he smokes 1 pack a day. That doesn't mean you should smoke 1 pack a day because it's going to catch up with you sooner or later. I just doubt that it caught up with him at 23.
Okay, let's see. But when someone this age dies with no apparent cause, there's one unfortunate possibility that does come to mind.
You know, somebody this young, we always worry about drugs. His wife said that he does smoke marijuana, but she says as far as she knows, he doesn't use other illicit drugs. But, you know, sometimes they'll admit to the marijuana, but they won't admit to, you know, the other things. So that is definitely going to be a possibility.
Tom, could you hand me a male chart, please, and an internal?
But Dr. G knows that there's only one way to get the truth from Roman.
I will certainly figure out the cause once I do my autopsy.
Dr. G begins the external exam by carefully noting the appearance of Roman's body.
First thing I notice is he's overweight. He's only about 5'5", but he's about 200 pounds.
Okay, what?
You know, at 23, you don't get that belly as you do as you get older, but he was just kind of a big guy. I mean, it looked like he was not particularly out of shape. I mean, he still kind of looked muscular, but he clearly was carrying too much weight.
Obesity is linked to numerous life-threatening conditions such as high blood pressure, blood clots in the lungs, and cardiovascular disease.
We've got 3 really deadly things here, any 3 of which could be possibly lethal. Thanks.
For now, Dr. G continues scanning Roman's body for more clues.
Oh, he got a little bit of a scar here. He's definitely got evidence of resuscitation. They've clearly worked on him. He's got some resuscitation burn over his sternum. He's got intravenous catheters in, trying to give him fluid, EKG pads. A scar here.
Given that an overdose is a prime suspect, she keeps an eye out for the telltale signs of drug use.
I'm looking for needle puncture marks.
And scanning Roman's arms, Dr. G does spot some recent marks that may have been left behind by needles.
Yeah, there.
But she can tell right away that they are not the result of illicit drug use.
All of his needle puncture marks have gauze over them, indicating to me that the hospital was attempting to draw blood or start IVs.
She continues her search for evidence of drug use.
I'm looking for a septum that may be perforated from chronic sniffing of cocaine. He doesn't have any of that. Let's see what else we got.
But Roman's face holds a clue that raises her suspicions.
He has some frothy fluid in his oral cavity and a little bit in his nose. That's worrisome. Oftentimes we will see that with drug overdoses. That's not good.
As she concludes her external investigation, Dr. G is more concerned than ever that her findings could spell bad news for Roman's grieving family.
It's a guy that I think's using drugs, but we'll see when we get in there.
Meet Omnilux Contour, an LED light therapy mask clinically proven to reduce fine lines and wrinkles. Find out how you can improve your skin at omniluxled.com.
Confused by the Medicare ABCs? If you have Original Medicare, then you have Parts A and B. Have you considered Part C? Medicare Part C is sometimes known as a Medicare Advantage plan, and it's one of the best ways to help protect yourself from out-of-pocket Medicare costs. If you only have Medicare Parts A and B, there are 3 things you should do. 1. Call the number on your screen. 2. Give the licensed insurance agent your zip code. 3. See what Part C plans with benefits are available to you. 1, 2, 3. It's that easy. Medicare Part C plans are available with benefits you may not be receiving with your current plan. If you're losing benefits, moving, or new to Medicare, you may be eligible to enroll in a plan today, but you won't know unless you 1. Call the number on your screen now. 2. Give the licensed insurance agent your zip code. 3. See what Part C plans with benefits are available to you. 1, 2, 3. It's that easy. Medicare Part C plans are available now. Plans may include benefits you are not currently receiving. Call today. You don't get a Medicare Advantage plan automatically. Call to find out if you're eligible for a special enrollment period. If you're losing benefits, moving, or new to Medicare, you may be eligible to enroll in a plan today. If you only have Medicare Parts A and B, there are 3 things you should do. 1. Call the number on your screen. 2. Give the licensed insurance agent your zip code. 3. See what Part C plans with benefits are available to you. 1, 2, 3. It's that easy. Medicare Part C plans are available with benefits you may not be receiving with your current plan. If you're losing benefits, moving, or new to Medicare, you may be eligible to enroll in a plan today, but you won't know unless you call. Call today for your free Medicare benefits review. The call is free. There's no obligation.
Call 800-408-3192. That's 800-408-3192. Call now.
Introducing Weight Watchers Clinic.
Our team of doctors will help you find the right medical weight loss plan, including medications if appropriate, with ongoing support from our nutrition and fitness experts.
The care you deserve from the brand you trust.
This is the best anti-aging serum I have ever used. Chabula Serum by True Botanicals. It targets 5 signs of aging. My skin looks so plump and glowy.
Chabula has been tested and proven to help deliver dramatic results. 100% saw softer and smoother skin after just 1 week.
It's completely transformed my skin. And like all True Botanicals products, it is clean and sustainable. I'm completely obsessed. You have to try it.
Shop Nordstrom or TrueBotanicals.com for 2 free gifts.
When someone dies unexpectedly, only an autopsy will expose the truth.
I need to look to see if there's evidence of a struggle. We're going to have to open him up to really see what the injuries are.
Dr. G, Medical Examiner, next on True Crime Network.
Dr. G sinks her scalpel into the skin of 23-year-old Roman Glebinski's chest and abdomen, creating a Y incision.
Let's see what we got going on.
She's now worried that what she'll find inside his body will confirm her darkest suspicions.
Yeah, sudden death, 23-year-old while the wife's gone. Maybe he was using drugs. It certainly would be high on my list.
Dr. G carefully peels back the skin to expose the front of Roman's chest cavity.
There, I do find rib fractures, ribs 4, 5, and 6 on both sides, and very minimal hemorrhage surrounding it. So it doesn't appear to be from trauma, it appears to be from CPR.
Hold that for me like that.
Immediately, she collects blood and fluid samples to send to the lab for drug testing.
What is important is that I remove my toxicology, because at this point I'm worried that is probably going to be the answer.
If you can't see it, I gotta go to AIM.
But while she waits for the results, Dr. G must exhaust all other options. She begins by examining the abdominal organs one at a time.
Anything interesting around here?
The liver looked fine, the spleen looked fine, the bowels all looked normal.
Pancreas isn't looking so bad.
There was nothing wrong with the kidneys. There doesn't appear to be anything acute going on in the abdomen that would have caused his death.
Next, Dr. G removes the chest plate to get a closer look at Roman's heart and lungs.
I remove his lungs first because the possibility is that he has a pulmonary embolus.
A pulmonary embolus is a lethal condition that occurs when a blood clot blocks the pulmonary artery that carries blood to the lungs. Roman's obesity puts him at risk for developing these types of blood clots.
When I cut the lungs off and look at the pulmonary artery going into the lungs, there are no pulmonary emboli. They looked completely fine.
Well, no PE.
I can definitely eliminate pulmonary emboli.
But she does spot an abnormality.
Right lung is going to be heavy. Ooh, 990.
There is definitely an increased amount of fluid in the lungs.
This fluid buildup, known as pulmonary edema, supports her theory on how Roman died.
When we see edema in the lungs when somebody dies suddenly, I think of a drug overdose.
But she can't be sure until she gets the toxicology report. In the meantime, there's one organ left to examine: the heart. And there the case takes a shocking left turn.
Oh my gosh. When I open up the pericardial sac, you can see this large, globe of a heart.
Ooh, that's a big heart.
His heart should only weigh, at most, 375 grams. This heart weighs 800 grams. More than twice what it should weigh. An 800-gram heart in a 23-year-old, young man is really unusual and it's really remarkable. The heart is clearly the cause of death.
Not only is she sure that Roman's heart was responsible for his death, she's now convinced that drugs probably had nothing to do with it.
This investigation's going in a different direction. We don't have all the answers just because we have an enlarged heart. What is it that's causing his heart to beat like that?
Dr. G begins with a careful dissection of the organ. She examines the coronary arteries, the vessels which bring blood to the heart.
He's got about a 75% narrowing, which is significant, in one of his coronary arteries, with the rest of them completely normal.
The extent of Roman's coronary artery disease is more than she would expect to find for someone his age. But it wouldn't have made his heart expand to twice its normal size. Something else must have caused the organ to enlarge.
There's clearly a lot of work I still have to do.
One chamber at a time, she inspects the heart valves.
The valves all look normal.
Next, she slices into the thick heart muscle itself. And here, she discovers a subtle abnormality.
When I look at the heart muscle, it looks asymmetric, meaning it's not the same width all the way around that left ventricle. This is a terribly ill heart.
We got a oh boy.
So ill, in fact, it looks like it's been deteriorating for years. It's an important finding,
All right.
but unfortunately, this makes it even more difficult to ascertain exactly what's behind Roman's heart problems.
Now you think, what difference does it make? It's a heart disease. It's, let's leave it at that and go home. But there's a lot of questions to be answered, some of which has some definite implications for those kids that he has and left behind.
If Roman's heart was the result of a genetic defect, his kids could have inherited the deadly condition.
They clearly are at risk for sudden death also. So it's definitely something we need to answer for that family.
You're probably wondering who we are. I'm Patrick, and that's Chase, and this is our next giveaway.
We're giving away this 3-bedroom, 2.5-bath in the heart of the Ozark National Forest. You can win this cabin or $1 million cash.
Go to onecountry.com today. Sign up.
Today, sign up.
Or sign up.
Sign up today or tomorrow. No, you want to sign up right now.
At Consumer Cellular, we pride ourselves on getting you the exact same nationwide coverage as the leading carriers for up to half the cost. But don't worry, we've got a lot more than that going for us. Woo!
Like this beautiful store in Arizona, for example. It's the perfect place for me to tell you a little bit more about our phones and how they can become your phones. You name it, we probably got it. We have the top smartphones from all the major companies. If it's state-of-the-art cameras you want with space-age metal housing, we got them. If you want a smartphone with lots of bells and whistles but won't break the bank, we've got that too. We even have flip phones like the Iris Flip. If you're someone that doesn't need all that mumbo-jumbo and just wants something simple. And now, we even have watches.
We do.
No matter what device you choose, you'll be happy to know that if your data needs change,
No problem.
with our Smart Flex feature, you don't have to sweat it. Like say you're on a road trip out west and end up using a bunch of data. We can simply flex you up to the next data tier for as little as $5. Then, when you get home, you can flex right back down with no penalty, so you only pay for what you actually need.
With Consumer Cellular, you get the exact same nationwide coverage as the leading carriers for up to half the cost.
I know what you're thinking. What if I don't have one of these amazing stores in my town yet? Can I get these phones sent to me?
Yes, you can.
Will our award-winning customer service help me switch over or add a line for $15 to make my own family plan?
Of course they will.
Is it easy?
Easy as pie.
You see that tower out there? It's a beauty. And there are thousands more like it, working hard for me and you, supplying 5G coverage to this beautiful nation of ours. We know how important coverage is. That's why we offer a risk-free guarantee. If you're not satisfied within 30 days of activation, you can pay nothing. Oh, look.
And for a limited time, new customers get their second month free. Call 800-311-5340. Find us in Target or visit consumercellular.com to switch today.
She knows what she's talking about. Pick up the phone.
Wow, is that really me?
Oh my gosh. Wow. Who am I?
Oh my God, I can't believe I have no lines in my face.
I'm just in love with the mirror right now.
It's a facelift in a jar.
Hi, I'm Jonathan Greenhut, the CEO of Plexiderm. We've created the best offer yet with our Memorial Day Plexiderm 10-minute challenge. All it takes is 10 minutes to reduce the appearance of under-eye bags, wrinkles, and crow's feet. People across the country look and feel years younger in minutes.
Here, I don't look 61 in 3 weeks, and this is only because of Plexiderm.
Holy like I look 15 years younger. The instant results are from naturally based silicates. Once applied, your skin tightens and firms, rapidly reducing the appearance of under-eye bags and wrinkles in minutes. So if under-eye bags and wrinkles make you look tired and older, try it this Memorial Day for only $14.95 plus get free shipping.
23-year-old Roman Glebinski fell victim to a heart condition he didn't even know he had. And now it's crucial that Dr. J figure out what caused it.
It's from the heart.
Yeah. He's got 2 kids. And, is it something that they could have inherited? What I really need to find out is some more history. So I call the wife. She tells me that she thought he was perfectly healthy. I want more information.
Dr. G asks medical investigator Carol Crosby to contact Roman's parents.
The problem is that she has a very hard time communicating with his family because they're Eastern European and they don't speak English.
But with the help of an interpreter, Carol is able to glean some valuable information.
What she got from the family is that as a young child, about 7, 8, he was being worked up for something wrong with his heart, that they wanted to operate, and the father refused to let the operation occur, and they just never took him back to those doctors. Now that just piqued my interest.
Hey, Carol, could you give...
So I asked her, where was he treated?
Carol learns that Roman received treatment at a hospital in Boston, but his parents can't recall which one.
I'm like, oh, brother. Poor Carol, who I'm like having call every hospital in Boston, try to go the extra mile to get those records for me to see if we can piece it together.
I'll be back.
Meanwhile, because this has been taking months, I didn't think I'd ever get these records. But I really, on my own, couldn't come up with a cause. You know, at some point I felt like just quitting, but you know what? The answer has implications for the kids and their future health.
Thankfully, the team's diligence eventually pays off.
Thank you, oh, hallelujah.
Carol locates Roman's old hospital records, and as Dr. G expected, they provide a critical final piece of the puzzle.
This is why I'm in forensics. A, the answer means something to somebody. B, I had to do a lot of detective work to try to put it all together.
On the day of his death, 23-year-old Roman Klebinski is at home with his 2 young children. But little does he know that inside his chest, his heart has deteriorated and ballooned to more than twice its normal size. In fact, the organ has been diseased since the day he was born.
I get the medical records, and it appears that he had the asymmetry from the very beginning. He was born with a primary hypertrophic cardiomyopathy.
It's a genetic defect that triggers abnormal growth in the cells of the heart muscle. Most likely, the heart murmur that Roman's doctor detected when he was a child was an early sign of this defect.
Maybe this benign heart murmur wasn't so benign.
When Roman was 8 years old, his doctors recommended heart surgery.
And it would have helped his heart.
But convinced the procedure would be too dangerous, Roman's father declines. And as the years pass, his son's heart grows larger and larger.
Unfortunately, hypertrophic cardiomyopathy was a silent killer, meaning no symptoms until death.
Roman may feel fine, but on that ordinary October morning, he's already in big trouble.
His heart is failing and dying.
As the heart dilates, the muscle